As the income of millions goes down, the cost of food and fuel really rises quite substantially. And actually, saving has become a pipe dream for many people. The introduction of universal credit and zero contract hours has meant that millions have left struggling to put food on the table. And in actual fact, 8 million people in the UK do not have access to healthy, affordable food. That is the total population of Wales and Scotland. I think we can agree that hunger is no longer just a third world issue. Since 2013, families, especially those with children and on a low income, are facing an entire life living in poverty. And just by getting older, you are more likely to suffer from ill health, malnutrition. I think we need to do something about this now. We can't wait any longer. The choice between putting gas on your electricity on, the heating on, or paying your rent is literally a choice that nobody should have to face. And they are. So I'm here to talk about hunger, but how can people be hungry in a country where we throw away 1/3 of the food that we buy? Well, the answer is food insecurity. So food insecurity is when people do not have access to healthy, affordable food because they do not have knowledge, because they do not have access to facilities, or because they just don't have any money. And these people are suffering from food poverty. And to give you some examples, for children, in the holidays, if they get free school meals in the holidays, they won't eat, because this is a meal that their families can't afford to provide for them. And looking at elderly people, just by getting older, you are more likely to not eat. In fact, I work in the community, and I did a survey with people, and 1/3 of the elderly people we surveyed either ate less, ate little, or didn't eat at all. And many spent an entire day in the past year not eating anything. This is not really surprising if you consider that the government has spent £1 billion less on community services over the past 5 years. Things like Meals on Wheels are the first things that have gone. And Meals on Wheels is when a meal is delivered 2 to 3 times a day by a friendly face. And for some elderly people, this is the only contact they will have with another person. So they've been given other options of things that they could do. They can get a takeaway, they can go to a luncheon club, or they can get a delivery service from, a supermarket. But bearing in mind that 6 million people, 6 million pensioners even, have never used the internet, that's an entirely ridiculous suggestion. And if you're suggesting that they should order in a takeaway with the very little pension money that they have, also totally unobtainable. It's very distressing. Report by the Food Foundation, very closely linked: food insecurity, poverty, and malnutrition. And all people are at risk of malnutrition. So there is another option, the food banks. Everyone's heard of a food bank. This year, 1 million adults accessed a Trussell Trust food bank. And to access a food bank, you are given a voucher, you're given a place to go to, so you have to take yourself there. You're given 3 days' worth of emergency food, which is tins or toiletries. Then you take that home and you cook it. And when I asked some people, well, why are you not using a food bank? One gentleman said to me, well, if you don't have a cooker to cook it on, then what are you going to do with it? What's the point? And that's actually true. A lot of people do not have cookers. And some people have 2 electric rings. But the cost of actually putting that on is so high, it's cheaper to buy a microwave meal, which is full of salt, or to buy a $1.99 chicken and chips down the road, which is full of grease, but it fills the void for a while. So what is the solution for the other 362 days of the year when these people are going hungry? And what happens to the other millions of people who are not being picked up by food banks? So earlier on this year, I actually went to LA because I heard that they're doing a lot of work there around food poverty, and I was hoping I could pick up some tips and be part of the solution. In LA, I volunteered at a place called Skid Row, and it is 1 square mile of homelessness. There is tents, as you can see from the photo. There's tents on all of the pavements, and sometimes at 6 a.m., people are forced to pick up their tents and move them, and that's their entire house in there, and move them so that the floors can be washed down with bleach. I worked at a place called the Hippie Kitchen, and we cooked some soup, and we doled it out to 1,000 people. And the people that came through the door were elderly people, people in wheelchairs, very disabled people, mentally disabled people, or people suffering from mental ill health, young people and teenagers. And I just thought, these are people's families. And what has happened that they are on the street right now? And to be honest, I could understand how they might have got there, because I myself went through something similar. In 2006, I was hit by a car, and I suffered a subdural hematoma, which is a blood clot on the brain. I was in hospital, apparently a very quick recovery. I was in hospital for 2.5 months. I was in a coma for 2 weeks. But when I recovered, I was very, very ill. Well, when I got out of hospital, I was still ill. And it took me 2 years to actually fully recover to a point. I remember going home, and I had to move out of my family home because they lived upstairs and I couldn't walk upstairs. And the day I went to the job centre you have to go and sign on, with a Zimmer frame, and I was told, you're fit to work and you've just left your job, so you're not eligible for anything. It took me six months to claim any benefits at all. In that period, I had no money. I had family and friends, but it was very embarrassing to say to them, I'm really hungry and I can't afford to put gas on, and I haven't got any food at home, and if I put the electric on, then I don't know what I'll do for the rest of the week. So I just didn't eat. And I was literally probably a quarter of the person you see here today. So when I was given the opportunity recently, 5 years ago, kind of recently, to actually help people in that situation, I really took that chance. And I now run a charity. It's called Be Enriched. And actually, we don't do anything particularly radical. We just feed people. We cook a meal, and everyone sits down. We eat. And, the food is free, and that's the difference. And it's healthy. We have people that come every week, and they eat with us, and they've made friends, they've made connections. And it's important to point out here that in this picture, the top one is LA, and the second one is London. So the future is here. We're not waiting for it to arrive. We have to do something now. So these are my key ingredients for how we stop food poverty turning into real poverty that we're seeing, or even more poverty that we're seeing on our streets. I think we need to have buildings where we can build connections and when people can build networks with real people. I think we need to create opportunity for these people to learn cooking skills, to learn transferable skills, to learn work skills. I think we need to have someone there who can provide professional advice, debt, housing, everything. And finally, we need to be able to provide healthy food. This should be affordable. It could be growing, and it can be selling the same food, but we need to have food there. Now, I know that these are very high-level sort of ideas, so everyone get your notepads out. This is what you can do. So you can donate food to the Home Cooks Project, who will connect you with an elderly person in your area who I'm sure will really enjoy having a nice home-cooked meal being delivered to them or you can put it on Olio. And maybe that's for a younger generation because that is for an app. You can volunteer your time and skills, and I'm sure everybody here has skills that they can share with others. And you can find a good opportunity on Project Dirt. You can attend a community meal like mine, which normalizes that very human experience of just eating a meal together and reducing all the shame and stigma that a lot of people feel when they go to a food bank. Finally, you can call your family and friends. And, I mean, call your grandma, call your granddad, ask them what they ate that day, or maybe even teach them how to use Instagram, and they can Instagram a picture for you. And I think with all of these things, as a community, we can really create an environment where everybody has access to food that is good, healthy, and affordable. Thank you.